Hi, I'm James Haddo. So in the last video you saw how to open and enable your report, and now I'm going to talk you through this dashboard. So this is the first sheet that you see, and it gives your name up at the top, and it tells you what period the report is over. This is a maximum of 3 years, just because we have to limit the amount of data being downloaded for size and performance reasons. The first metric you see here would be the number of admissions over that period, and comparing it against how many in the unit. And that's because actually it's not just your data that's in this sheet, it's also the data of everyone else in your unit. But to preserve privacy, the names of patients and staff for cases that are not yours have all been anonymized. So the next card here you see is a number of operations. The next card here is mortality, and this is for emergency laparotomies. And the definition of emergency laparotomy is pretty similar to that defined by the NELA audit. For example, perforated DU repair, regardless of whether it was an open or a laparoscopic procedure, would be included in these figures. And then on the bottom row here, you have data pertaining to elective cases. So we've developed this idea of an elective index procedure, which is a procedure which you would perform in your subspecialty on a routine basis and is a relatively good proxy for quality. So in colorectal, for example, this would be segmental colectomy, which is performed regularly. Is repeatable, and we would expect reasonable outcomes, although it is a procedure that does carry a morbidity and mortality. An example of one that is not in that list would be, for example, an inguinal hernia repair. And although that's a common procedure, it's something that all surgeons do, so it's not a specialty surgery as such. And also it carries a very low mortality and morbidity, so it wouldn't be a very good indicator itself of surgical quality based on those metrics. So that sort of surgery is not included in that list. Any admission that has carried an elective index procedure is therefore called an elective index admission. And on this data here, there's 28 of them, and the median length of stay was 5 days. And you can compare that against the units data at the bottom bar here. And then for severe complications, in DIVA, that is graded as just severe, but coming up will be the Clavian-Dindo classification, and that will be grade 3 and above. And then for mortality, obviously that's the mortality for these elective index admissions and compared against the units. So that's this dashboard. It's in development, and more KPIs can be developed in future. So we'd be really interested to get your feedback. Just click this link up at the top to send us an email. Thanks.